My guest at this time is Grace Marie Turner. She is president of the Galen Institute, one of the most respected healthcare policy firms in the nation. She joins me today to talk about House Democrats officially introducing the Medicare for All Act of 2019. The legislation would effectively ban private health insurance and require everyone to enroll in Medicare within 2 years of its passage. All primary care, hospital, and outpatient services would be covered by Medicare without any copay or out-of-pocket costs. We'll dig into this as much as we can here in the next few minutes. And Grace Marie, thanks so much for being with us.
Always a pleasure, Greg. Thank you.
Well, a lot of Democrats have been talking about single payer or Medicare for all, as they term it in their public relations. Are you surprised that it's become legislation already?
Not only one piece of legislation, I think there's 6 different bills, which shows that there's a real imperative among Democrats who, including many of the presidential candidates, to advance this forward. Somebody pointed out yesterday that this seems like the left's version of repeal and replace. I mean, they're not talking about a full-bore attack to save Obamacare and improve it. They're saying, let's replace this and start over again.
Grace Marie, it's been 10 years since we started talking about the Obama administration's health care reform efforts. It's basically 9 years now since the Affordable Care Act was signed into law. And for many different interviews, you explained that what the president was trying to do was a stepping stone towards single payer, and that the system that was being created back then couldn't last, and ultimately the left would say the only solution is to have government-run health care. So based on what you knew at the time, is this about when you thought this would be happening?
It's actually probably a little sooner. I thought that they would wait until Obamacare was in even more trouble than it is now, with some people paying $4,000 a month premiums. But you're right. I mean, they are basically saying, let's just, as Kamala Harris said, let's just eliminate all of that when she's talking about private insurance, including the coverage that 173 million Americans get through their insurance at work. And it would also change the Medicare program. If you have all Americans on Medicare at rates that are below the cost often of physicians providing that care, you're going to also change the program for 60 million Americans on Medicare who are going to have a much harder time finding a physician to see them.
Let's break this down. First of all, what happens if you get rid of private insurance?
Well, what happens is you wind up eliminating choice. Your only choice is the plan that the government offers, that Washington is going to be deciding every service that is available and eligible for payment. They're going to be creating an even longer list of essential medical benefits, and it's all going to become much more political, Greg, that if people who are going to, we think we have lobbyists here now, wait until everybody who's being paid in the healthcare system has to argue to have their service included in this one government-run plan. And I think what that also is going to mean is physicians are going to have to be prepared for cuts of up to 40%. As well as hospitals. They're going to go out of business. That's the only way that they can keep it within their $32 trillion price tag over 10 years.
And when you talk about everyone being thrown on to Medicare, then, if you talk to a lot of seniors, obviously the system's going bankrupt, but they'll say they kind of like the way that the system works for them. But if you funnel everyone onto that, explain what it looks like in reality.
Well, what it looks like is going to be Medicaid for all. And as we know, Medicaid, which is the federal state program for lower-income Americans, most physicians cannot afford to take more than a few patients at the Medicaid rates. I had one physician tell me, for example, that when he got his Medicaid reimbursement for treating a patient with pretty complicated lung disease, he got a payment for 1 penny. The check was 1 penny. Other people have sent me pictures of checks they've gotten for 8 cents. There's no way physicians could be able to continue to provide the same quality of care they do at Medicaid reimbursement rates. And I think they don't understand also, Doug Badger of the Galen Institute recently wrote a paper about this, how much Medicare Medicare, not Medicaid. Medicare is underwritten by people with private insurance, especially those with job-based insurance, that they pay basically higher rates so that the government can get away with paying lower rates through Medicare and, of course, Medicaid.
If there's any confusion out there, Medicare is the program for seniors above the age of 65, and Medicaid is the program for low-income Americans. So, Grace Marie, what is the counter to this, both in terms of public relations and in terms of a legislative strategy? Republicans now, of course, in the minority in the House. They are in the majority in the Senate, so plus President Trump's in office, so there's virtually no chance that this would actually get through in this Congress. But what is the way you expect conservatives to push back on this in order to point out that regardless of when this is taken up or which party is in control, that they don't think it's a good idea?
Whenever this idea of a single-payer healthcare system, government-run single-payer healthcare system, which is what Medicare for All is, comes up in states, it is overwhelmingly defeated once people learn just a few more details, like your taxes are going to double. You are not going to have access to guaranteed access to your physicians, basically because they may not be there. In Colorado, most recently, had it on the ballot in 2016, and it failed. 80% of people voted against it in Colorado with the multi-million-dollar advertising campaign. So what we need to do is help people understand a better path forward. And actually, I'm heading into Washington in just a few minutes for a meeting with my health policy consensus group to really provide and to really help articulate the more robust free market solution that gives people choice, lower costs, that continue the innovation in our healthcare system, which also is crushed when you have a government-controlled system. They don't pay for innovation; they just pay for what we've got, what we have now. So we have to do a better job of articulating why a functional free market in the health sector would work, which we really haven't had for several decades.
2 or 3 questions left here in our remaining time, Grace Marie. One of the arguments you're going to get, and you and I have had this conversation many times over the years, is that, well, look at Canada, look at the UK. It's very easy for folks in government-run healthcare to get to see their primary care physician. You've pointed out in the past that it's much, much tougher to see a specialist in that system. So if, in fact, this were at some point to become law, what would it be like for Americans trying to get relatively quick attention from medical professionals?
Virtually every system that has a government-run healthcare system, and every country is different. There's no one cookie cutter here, has waiting lines. Care is rationed. We've just put out another paper talking about the limited access in other countries to the modern drugs that can actually cure diseases and cure cancer, and that dramatic treatments, but they're expensive. This country pays more because we also paying for the we are paying for the research and development costs. But on an individual level, people would find hospitals closing in December. If you had a surgery planned for December 5th, forget it. It's likely to be canceled because these systems would be operating under a global budget. If they run out of money in October, November, then they don't open again until January. We see that over and over in Canada. Waiting lines, you may be able to access a primary care physician relatively easily, but if you need a specialist, if you need to see an oncologist or a radiologist, or you need a complicated diagnostic, you are likely to have to wait for months until you can get into the line to be able to get that care. When you're under a global budget with low payment rates, you don't get not only do you not get the newest innovative treatments and diagnostics, but you will be in a waiting line much longer than now for treatments that it most disadvantages sick people. If you're healthy, that's great. But if you have serious health problems and you need care, you are going to have a much harder time getting the drugs you need and a much harder time getting the surgeries and other medical treatments you need.
Sobering to say the least. 2 quick questions politically. You and I have talked about this several times. Given now that the Republicans don't control the House, how much frustration remains that they weren't able to get health care reform done in the previous Congress?
It's really disturbing, and as we know, it really came within one vote of being able to get to conference when I think they would have been able to come up with a much better solution to the problems we're seeing with Obamacare. There is a bright light in what the administration is doing with some of its regulatory authority to give people policies that they can actually afford. We call them short-term limited duration plans, but people know them as bridge plans. If you're between jobs, if you're starting a new company, if you're an early retiree not eligible for Medicare, then you need a bridge policy, and that's what this administration is offering at much lower prices than the Obamacare prices. They are also providing the opportunity for small businesses to gather together under associations to be able to get the same kind of economies of scale that people get when they have a large employer purchasing their health insurance for them. So the administration is doing a lot, and including giving people much more flexibility through an existing provision of Obamacare, the State Innovation Waiver Authority, to, for example, do a better job of providing subsidies for the sickest people so that they don't wind up raising premiums for everybody else. They're seeing, for example, in Maryland, that the premiums are 43% lower than expected because of a few changes that the state of Maryland and several other states have made to their risk pools. So there are things that are being done right now, but it is very frustrating, to your question, that they didn't have a chance to actually offer legislation and get it through so that we don't have the mess we now have that Democrats clearly want to replace it with Obamacare, with the problems with Obamacare, to replace it with Medicare for all.
And lastly, Grace Marie, this is purely political. The Democrats obviously got bludgeoned on the health care issue in 2010, and I think a lot of people would argue they got hurt by it in the three successive election cycles as well. Are you surprised that they're throwing specifics out there right before a presidential election?
Not at all. I mean, they wanted nothing more than to get on the offensive on health care. They've been on the defensive, as you say, for 4 election cycles. And they pulled one small provision of Obamacare, the pre-existing condition protection, and then they spent certainly hundreds of millions of dollars in advertising and 140 seats in the House. So you know for sure they're not giving up on that. And Republicans have to come up with a better idea and a better answer than they did in 2018. We had proposals that we offered to them, but they were just so shell-shocked after the defeat of their year-long effort to repeal and replace Obamacare in 2017. They didn't want to go back to this issue, but they're going to be forced to go back to it. And I think you're going to see a big contrast in 2020 between a system in which the government promises you everything, free access to health care, no premiums, no co-insurance, no deductibles, or a plan that gives you choice, that puts you and your doctor in charge of decisions in a much more functioning market where you have policies that you want to buy, not the ones that the government has been forcing you to purchase. So I hope that we can have a contrast in philosophies and really have the American people make a decision. Which way do you want to go?
It's undoubtedly going to be a big issue in the coming campaign. Grace Marie, always good to have you with us. Thank you so much for your time today. We appreciate it.
Thanks so much, Greg.
Grace Marie Turner is president of the Galen Institute. I'm Greg Columbus reporting for Radio America.